Good afternoon. Today is June 11th, and today I'll continue to talk about the coronavirus. So the first piece of news I'd like to talk about is that for the first time, a young COVID patient in the U.S. has received a double lung transplant after the coronavirus ravaged her lungs. The patient, a Hispanic woman in her 20s, spent 6 weeks in the ICU at Northwestern Memorial Hospital in Chicago after developing severe COVID-19, and she was hooked up to a ventilator and an extracorporeal membrane oxygenation, or ECMO, machine to keep her heart and lungs going. By early June, her lungs showed irreversible damage, and she was placed on the waiting list for a double lung transplant. Double lung transplants, in which both lungs are replaced with healthy ones from donors who have died, were first performed in the 1960s, but they didn't become widespread until the 1990s. And though survival has improved over time, lung transplants remain very risky compared with kidney or heart transplants. And this is the first time that the procedure has been performed on a patient with COVID-19. However, before the patient could receive the procedure, the patient had to test negative for the virus, and as lung transplants are usually given to people with active infections. She was almost the sickest person in the COVID ICU and possibly the entire hospital, and when she finally tested negative, she was immediately put on the transplant list and a donor was found. The surgery took 10 hours, several hours longer than normal, because the inflammation caused by COVID-19 had left her lungs completely plastered to the tissue around them, the heart, the chest wall, and the diaphragm, according to the chief of thoracic surgery and surgical director of the lung transplant program. Her lung damage was one of the worst ever seen by the doctor, and while the woman had no serious underlying medical conditions, she was taking an immune system suppressing medication for a minor illness, and the patient is now recovering well. So I think what is scary about this is that here you can truly see the impact of by the COVID-19 to a healthy woman in her 20s. This isn't even into like an older age population, and I think this really shows how truly dangerous the coronavirus really is, and the importance of wearing a mask and social distancing to try to prevent the disease, even for younger people. So if you're like young and healthy, don't think that you could be spared by this, because this is exactly the perfect example of how much damage the virus could have done, and this patient could have easily died just as we could have if we developed COVID-19. The second piece of news that I'd like to talk about is that there are definitely new treatments available right now for the coronavirus, and the pharmaceutical company Regeneron announced today that it was starting a clinical trial of an antibody cocktail that may one day treat and even prevent COVID-19. The treatment, similar to one shown to be effective for Ebola, would work like the antibodies that people naturally make when they're infected, and if the testing is successful, thousands of doses could be produced by the end of summer. For the most critically ill, there is also new hope for patients whose immune system set off cytokine storms, which cause the body to turn on itself as it fights the virus and could essentially kill patients. At least a dozen treatments and several blood purifying devices are being tested to calm the potentially fatal reaction, and one promising drug from Roche is in several clinical trials, including a late-stage trial in combination with the antiviral drug remdesivir. So here I think it really shows how there are so many vaccines, treatments that are being produced right now, and I hope that with all these scientists working together, we can truly achieve a vaccine and help those who are in need, especially just like I just talked about, especially these young patients and the older population as well, to try to save as many people as we can from the coronavirus. And with so much competition going on, there's almost more than 120 vaccines currently in development, and I think there's got to be one vaccine or treatment that can show to work. And I think at this time, what the general population can do is just to wear a mask, social distancing, don't let your guard down, even if Even if the cases are going down, and you can go by the 5 rules that I talked about in my previous video. That's it. Thank you for listening, and I hope you have a good day. Thank you.